Welcome. Thanks. So we're going to record, just to let you know right at the start, we're going to record just so that we can share this with more people and get as much information out as possible. Thanks for making time in your evening, like I said, to come tonight to talk about retail cannabis through a public health lens. We have with us tonight, my name is Mary Morris. I'm Executive Director of the Collaborative and one of the lead people for Green Peak Alliance, who's hosting this event tonight. With us, we have Rachel Scudder from Mount Ascutney Regional Commission, who's going to be doing part of the presentation that is specific to town rules and timelines and things like that. And then my counterpart for this is Melanie Sheehan of Mount Ascutney Prevention Projects. And she's also one of the leads for Green Peak Alliance. I also have Alice Abraham from my team at the Collaborative on to help with some management of our comments and chats and getting questions answered as best as possible. So thanks for that. We'll roll right along here. Green Peak Alliance is a regional network that promotes health in communities for everyone. And it's comprised of a bunch of different other organizations like mine. My organization, the Collaborative, is a substance misuse prevention organization, but we have some of organizations like that. We also have partners with the Regional Commission. We have partners with Turning Point Center. We have partners with law enforcement and hospitals and things like that. So Green Peak Alliance is sort of the overarching organization that we all do work within. And it generally covers some of Windham County, Windsor County, and Orange County. We increase youth assets and reduce substance use. And the reason why retail cannabis conversation is relevant to our work is because towns are trying to make this decision about whether or not to host retail cannabis, and whether or not that happens in any of our towns, as it's already happened in some towns that they voted it in. There's going to be some health concerns, particularly for young people, regardless of that outcome. So we want to make sure that voters are prepared to look at it through a lens of what's unique about their town and what's impactful for them and their town, and make that decision as informed as possible. So again, there's this great responsibility for the public. It's going to affect everybody, whether or not you are retail, whether you decide to have retail cannabis in your town or not. And we just want to make sure that people are informed, and we'll answer questions at the end, just as a reminder. So this is an information session, so it's just some ground rules. If you want to ask a question, you can raise your hand in the chat, either physically or raise the little emoji of the hand, but please be brief. Better yet, if you can put your question in the chat, Alice will help collate all those questions so that we can get to them by the end. The focus on this issue is for retail and not whether or not cannabis is good or bad. As I started out, we believe that there's health concerns whether or not there's retail cannabis, but just trying to showcase all of the different ways that a town can look at it and citizens of a town can look at it. And anytime you think of a question, you can throw it into the chat box. And like I said, Alice will be monitoring that. First off, Rachel's going to go give the outline of the cannabis law, the Act 164, talk about what local Cannabis Control Commission can do and what they are. Melanie then is going to showcase some things around public health insights related to retail cannabis that has some backing data from states that have gone before us, that have legalized already and have had some learnings from them. And then suggestions for towns if an opt-in vote passes, because there are still some decisions to be made after a retail cannabis vote passes, if that's the choice for a town. And then afterwards, we'll go through the pre-submitted questions that you may have put in and answer some questions that have come up. And that's our schedule for the day. So I'm going to stop sharing and hand this off right now to Rachel to share so that she can go over some of those ruling pieces. Tell me when you are ready, Rachel.
Hi there. My name is Rachel Scudder. I'm a planner at Mount Escutney Retail Commission. Thank you, everyone, for coming tonight and listening to this presentation. I'm going to get started if that's okay with everyone. So I'm here tonight to talk about Act 164. I have some information that pertains outside of retail cannabis, but this is a presentation that's specifically focused towards the decision for our town to opt in or opt out. So as of January of last year, there was the Cannabis Control Board was created. Over the past year, the Cannabis Control Board has made some recommendations. They're still meeting to review aspects of the law and take public input. They've created a guidance for municipalities to move forward with. And then by later in the spring, they expect that rules will be adopted. And by October of this year, the Cannabis Control Board plans to start issuing retail licenses. So what is the Cannabis Control Board? It's an independent board established for the purpose of equitably and effectively administering the laws that enable access to adult use cannabis in Vermont. They make the rules, they administer compliance and enforcement, and they have taken over the administration for the medical cannabis registry. They control small cultivators, testing laboratories, product manufacturers, wholesalers, retailers, and integrated licenses. Some important highlights for Act 164, and a lot of this is skewed towards retail cannabis, is that it allows for cultivators, product manufacturers, wholesalers, and testing laboratory licenses without municipality approval. So all of these aspects of cannabis will be allowed in any town, regardless of if a town opts in for retail cannabis or not. Municipalities are allowed to hold a vote to opt in to allow adult use cannabis retail or integrated licenses, either at an annual meeting or a special meeting. In terms of education, anyone purchasing cannabis shall be offered a safety information flyer that's provided by the CCB. The CCB will require training for employees for cannabis establishment that includes identifying signs of overconsumption. In terms of packaging and advertisement of retail cannabis products, they should not be appealing to anyone under the age of 21, be childproof, and then marked with appropriate warnings. Only adults over the age of 21 will be allowed entry, sale, and employment at cannabis establishments. As of right now, sale of non-flavored cannabis vaping products are permitted. There's a current ban on the consumption of cannabis in public remains. Medical cannabis, although it will be managed under the Cannabis Control Board, will operate under a different set of rules. And cannabis consumption is prohibited in any public place other than an individual dwelling, and any place where the use or possession of a lighted tobacco product, or tobacco substitute is also prohibited by law. And when it comes to the taxes and fees, in addition to the 6% state sales tax, there will be an additional 14% tax on cannabis products. As of right now, this does not go directly to the municipalities. The CCB did recommend this to the, but no decision has been made on that, unless a town has a local option tax. In terms of licensing fees, the state will collect all licensing fees and allocate the revenue towards administration. Currently, communities will only benefit from cannabis if they have that local option tax. And in terms of local fees, as of right now, the legislature has not approved specific local cannabis fee rates. And in terms of where the revenue will go from this, it will go towards enforcement, including data collection and reporting, which is aimed to improve outcomes for youth and vulnerable populations. It will go towards prevention efforts and recovery services. Municipalities must vote to opt in to allow adult use cannabis retail, either at an annual meeting or a special meeting. Municipalities cannot prohibit retail cannabis through any ordinance or bylaw. Municipalities considering a vote to opt in can create a local Cannabis Control Commission in order to develop additional limited regulations and requirements. The benefits of a local Cannabis Control Commission is that it can protect community interests when making cannabis policy decisions. It can ensure that local policy is thoughtful and intentional and considers all the needs of all of the town's residents. It gives a town an opportunity to shape how this industry might affect their town in the long term, and helps make recommendations where local funds can be allocated. A local Cannabis Control Commission can issue and administer local licenses for all cannabis establishments. This entity would function very similar to a liquor control board. It creates safeguards to protect youth and other vulnerable populations through regulating land use, which includes zoning, signage, and nuisance regulations. It can deny, suspend, and revoke licenses, but only for zoning, signage, and nuisance regulation violations. With the local Cannabis Control Commission, a municipality may still regulate cannabis establishments in the same way that they regulate other businesses through zoning, signage, and nuisance regulation. A retailer would need to seek local licensing before they seek a licensing through the Cannabis Control Board. A local Cannabis Control Commission cannot directly collect local license fees or separately levy taxes specifically for cannabis sales. They cannot prohibit the operation of cannabis establishments within the municipality through the ordinance or bylaw, and they cannot condition the operation or renewal of a permit on anything other than what's identified in the local zoning, signage, and nuisance regulations. Some ideas about who could potentially serve on a local Cannabis Control Commission: members of local government, including select board members and planning commission members, school staff, cannabis industry representatives, youth, parents, substance misuse prevention specialists, commerce organizations, and healthcare staff. And if a person has a conflict of interest, they might not be a good person to serve. Some questions that a local Cannabis Control Commission can ask themselves is: how close to schools, daycares, and other places where youth gather will the cannabis retailer be allowed? What can the towns do to pass zoning, signage, and/or advertising restrictions? How will cannabis manufacturers fit into the wider neighborhood? And how to administer local control of licenses and condition licenses on compliance with zoning bylaws and ordinances regulating signs and other public nuisances. And another good question to ask is: how do existing zoning bylaws create safeguards, or do they? Some other considerations for the local Cannabis Commission, local government, and communities. This slide is specifically geared towards not just retail establishments, but for other aspects of cannabis establishments, that even if a town does not have a local Cannabis Control Commission, they may want to look into. So that's why I included local government and communities. They might want to consider advertising, education, support, and empowerment or connection. Pay attention to how they establish a model of social norms surrounding cannabis usage, marketing, and access as Vermont moves into cannabis sales. Keep up to date on the regulation and laws. Consider health chapter updates to create goals and policies related to cannabis. Creating a local health and wellness committee if they haven't already. In terms of zoning, zoning buffers around family-oriented or recovery-oriented establishments. The Cannabis Control Board has already issued a statewide buffer of 500 feet from a school property, but that can be expanded. It cannot, under zoning, you cannot create a buffer specifically for cannabis usage, but you can create a category for other adult use establishments like a gun store or like an alcohol establishment or something like that, and kind of put all of those into one category and extend a buffer zone for that. Consideration of substance ordinance, like a tobacco or alcohol ordinance, which limits where cannabis is consumed, a sign ordinance to minimize signage for cannabis products, and density cap considerations. And again, just to be very clear, zoning considerations cannot be specific to cannabis operations, but can be under a category or something like that of adult use establishments. The timeline for the Cannabis Control Board is that by April, the Cannabis Control Board will start accepting applications for integrated licenses, small cultivator licenses, and testing laboratory licenses. By May, the Cannabis Control Board will start issuing the integrated licenses, small cultivator licenses, and testing laboratory licenses. By September, the Cannabis Control Board will start accepting applications for retailer licenses. And as of right now, the application period will be open for 30 days, but the Cannabis Control Board may reopen that depending on how it goes. And by October, the Cannabis Control Board will start issuing licenses for retailers. And immediately upon the issuing of a retailer licenses, sale of products may begin. So what towns can do right now is conduct community research and hold public hearings. They can collaborate with public health prevention experts, law enforcement, medical professionals, emergency services to explore state and local education policies. They can explore potential actions municipalities can take to promote youth prevention and public nuisance. They can establish local safeguards by creating a local Cannabis Control Commission, and they can initiate a town vote. So if they hold a vote, they can also recommend a local establishment of a Cannabis Control Commission. And that's all that I have for right now. But if you have any questions, feel free to email me or another planner who's been working on this project, Allie, and we'll be happy to help you out in any way that we can.
Thank you so much, Rachel. That was great. I'm breaking my rule. I said that we'd have questions at the end, but do you want to explain what an integrated license is, just so that we can get clarity of that before moving on? Or would you want to go on?
Yeah, I can answer that. I think an integrated license is a combination of the different licenses. So it's if you want to do like a retail shop and manufacture cannabis products, then I think you would need an integrated license.
Yeah, my clarity is that the integrated licenses will be given to already established medical dispensaries first, to then integrate retail into them. So unless there's already a medical dispensary in the area, there wouldn't be an integrated license to be given at that date that Rachel had. I can't remember if it was April or May, but that's a pretty soon date.
Yep.
Thanks again, and you're going to hang around to help us answer questions. Yep. So Melanie will take over and give us some insight around some public health considerations.
Thanks, Marianne. Let's get my text going. So I just want to do a general overview of what we're talking about with cannabis. There's marijuana or pot versus hemp and CBD, a lot of products out there. So let's talk a little bit about that. The state of Vermont has transitioned away from using the term marijuana, so I'm just going to say pot, and we're just going to talk about cannabis in that way. So both pot and hemp are cannabis plants. Genetically, their makeup and variety, they have multiple strains. They make the two very complex. In short, pot or marijuana contains delta-9 tetrahydrocannabinol, or THC. THC is the psychoactive ingredient that causes people to feel high or have that feeling of euphoria when they use it. Hemp, on the other hand, contains less than 0.3% of THC. So cannabidiol or CBD oil is often extracted from the hemp plant and should contain little or no THC. CBD product sales have been legal in Vermont since the federal farm bill passed in 2018. So again, reiterating what Rachel covered, Act 164 made it legal for Vermont to set up a regulated market to sell pot containing THC products for sale in the state through regulation. So what will be sold in stores? We're going to cover, we're going to take a little bit of a dive into the products. So basically, not unlike the evolution of the rotary phone to a highly sophisticated smart device, today's cannabis market has evolved and sells highly concentrated, potent, and sophisticated products. There continue to be, leaf and flower or bud products sold, but there are also products that can be eaten or vaped through an electronic vaping device. Again, different strains. There's sativa, there's indica. Each have different effects on the body, and therefore retail cannabis stores are opening a new market to a lot of different options for both a new to market user or a highly experienced user. So these pictures, I know they're small, they're hard for you all to probably see, but a lot of the edible products today come in the form of granola bars and gummies and cookies and brownies, also drinks. A lot of times the packaging or the product themselves look like an already existing product. So there's a little bit of brand confusion, and consumers are going to have to be very careful to make sure that they keep their products away from youth, because it can often look like regular youth appealing candy. Some of these products, actually, I'm going to flip to the next slide. Talks a little bit better here. So when we talk about potency and THC content, the THC content of weed in the 60s and 70s was around 4 to 7%. Today's products are much higher in THC content. Vermont has allowed, when they set up Act 164, they put some THC caps. So flower or bud or herb, leaf, whatever, is capped at 30% THC. It can't be any higher than that. And Vermont also allows those edible products, cookies, candy bar, brownies, gummies, to be capped at 60% THC. So there was sort of a lot of back and forth in the legislature when they're setting up the law, and public health was kind of happy just to see that there were caps in there, because that's new. Other states hadn't done that. So there was some goodwill to be putting some public health measures in place. The new law does not currently allow concentrates. They're not yet part of the Vermont retail market law. These products are often referred to as shatter or dabs or waxes. These are marijuana or cannabis that has been extracted and highly concentrated through the use of butane hash oil extraction processes or other highly sophisticated extraction. And again, those are trending nationally at THC 80% and even higher. There are some 90% THC values in some of these higher concentrated products. In Vermont, we also do have oils, tinctures, things like that. The oils can be vaped in some of the electronic products. An important thing to note is that when you're vaping, whether you're vaping nicotine products or CBD, hash oil, whatever, you can't tell from the vapor, you can't smell what's being utilized. So that can cause a bit of a concern in places like schools. We're already seeing some of this in schools where youth are using these products and teachers or parents don't really have an idea of what's going on. I'm going to skip down here. So just wanting to dive a little bit deeper in looking at some of the best practices and some data coming out from a public health lens. So truly, there's two top concerns that we have in public health. One is the strength and potency of these new age products. These have not been studied for long-term effects, and so we just don't know. We're kind of in an experimental phase right now. And also the greater availability of products has been found to change the beliefs in a society and a culture that tend to favor more use. So we're going to get into some specific studies, but in general, we are seeing that retail stores increase use among certain populations, especially youth and young adults, and is leading to unintentional consequences. So, generally, when you increase the number of stores, you increase availability, and over time, you change the cultural norms of a society. So that is sort of the public health concern there, because as norms change and beliefs become positive, there's a less hesitancy to use. One thing I want to make note of, there's some debate that these regulated markets are going to be safer than what we currently have because they're regulated. Cannabis became legal for adult use in Vermont in 2018 under a grow your own model. And since that time, and likely even before that law, adults who want to use cannabis have been getting it and have been using it. We don't have any data or any health system reports that are showing public health harm from that current model. So therefore, retail cannabis market is not being proposed to solve any current health or current public health issues. We are seeing increased unintentional harm in children and youth in other states with this newly established market, and we'll get into some data around that. And just to be clear, Black markets are not going away with these newly established regulated markets. So again, this model is not solving for any current public health crisis that we're seeing because we don't have a regulated market in the state. So I'm not going to talk about each of these studies. These studies are live links. Marianne, you can pop those in the chat if you want, but just want to show you that these studies that we'll be citing are coming from states like Washington, Oregon, California that have had legal markets for quite some time. And I'll cite a few specific ones. So this study from Washington State finds that as retailers opened, individuals used cannabis more and used it more frequently. These effects were seen specifically in young adults aged 18 to 26, in women, and specifically in rural residents. Mental health effects, such as addiction and psychosis, has been documented to increase 3 to 5 times when using high potency cannabis, greater than 15% THC, and or using nearly every day. And you'll remember that we currently have caps that are 2 and 4 times higher than this, so that's of concern. And even of greater concern is that concentrates that trend at 80 to 90%. We may see effects that we haven't seen before, and we want to be prepared for that from a public health standpoint. While some persons with substance use disorder are able to decrease their opioid use when using cannabis, there is data that shows that cannabis use appears to increase rather than decrease the risk of opioid use and opioid use disorder. So that's of concern as well. And lastly, we see that Poison Control Center calls for accidental ingestion of cannabis in, this says young persons, I should just say infants, children, has increased 140% in Massachusetts and 160% in Maine. And these are just a few studies. So there are more. I just want to note that you can find any piece of data on the internet to sort of back up what you want to say, probably guilty as charged, but all of these sources are coming from a .gov or a .edu site. So they're peer-reviewed studies that follow a scientific process. Any research that comes from a .net or .com or sometimes even .org generally tend to be less reliable in their data than a .gov or a .edu. So, current knowns and unknowns, and recapping your post-vote options. So again, we talked about the caps, we talked about concentrates not currently allowed, but the new law, I think it's S185, or Marianne, you'll have to help me out with that, is asking the legislature to remove the ban on concentrates. So they want to expand the list of products to allow concentrates, and they want extractions to be able to be greater than 60% THC. Currently, there's a 50 milligram per package limit for oils and tinctures, and they're asking to exempt oils and tinctures from that limit. That's going to increase the THC that you can vape in vape pens and other electronic products. And as Rachel already pointed out, towns do not currently get any revenue from hosting a retail store. The CCB has recommended that they allow them to receive 1 to 2% of the tax, but we won't know if that's true. We won't know if any of this shakes out until this legislative session is over. So towns that don't opt in now, you know, if they want to see how the legislature shakes out, they can call a vote later. I think you'll recall Rachel said you don't have to vote at town meeting. You can call a special vote at any time. So again, Rachel covered a bulk of this. I'm not going to read it to you, but the Cannabis Control Commissions really can be partners in public health. You know, looking at these, looking at the density cap or the location, looking at advertising, all of those things really are best practice approaches for youth substance use prevention. We talk about those model policies all the time, and we did long before cannabis became legal. I think one of the important things that gets glossed over a little bit is towns can decide locally what criteria would constitute a local license violation. So this helps the town to establish with their retailers, if they vote to opt in, how the retailers can be partners with the town. This is what we want, this is not what we want. And deciding on those violations is important. Also, it's important to decide what data a town wants to track or keep an eye on. So if there are concerns over time, if there's increased driving under the influence citations or selling to minors or, you know, whatever, then there's justification for calling a vote at another time. And we are going to address that in one of the questions. So again, I would highly recommend towns, especially if the opt-in vote does pass, that towns consider the options that Rachel did a really good job outlining for you: ordinances, buffer zones, nuisance, health chapters, establishing health and wellness committees. Our partners in regional planning are very versed in these issues and can be a big support to the town. People in prevention, treatment, and recovery want to also be good partners in that conversation. So towns can also run their own responsible use messaging campaigns and craft it for the town. And again, deciding on the data. So if things get worse, you can call another vote. So I'm going to stop sharing. And I think I went too fast, but whatever, Marianne, I'm going to let you take it from there.
Sure. Thanks very much, Melanie. I'm going to go ahead and share some of the questions that we got on the screen. Do you think that that was a good idea, Melanie?
Yeah. Do you want me to pull up these questions?
Yeah, if you can pull up the questions, that would be great. Thank you. So we got a couple of questions, and one of them was around, I don't think that we wrote this onto the PowerPoint, so we'll talk about it. One of them was around, how do you, when a vote to opt in is controlled by 1 or 2 members of select board, how do you manage to get that? Or that's the gist of the vote. And since this is a public health sort of a forum, we just wanted to say that there are towns that have gotten votes by getting the signatures to get on town meeting, and that should be a conversation with your town to try to get it onto an agenda if that's the way that you want it to go. If enough people can sign on to that to get it on your town meeting agenda, then the select board will feel compelled to put it on. So if the town votes to opt into hosting a cannabis dispensary, what is the commitment, and is the town committed to move forward, or can the town decline to do so at a later date? So towns can vote on the issue again at a next town meeting, or they can call a special vote anytime. But once a town opts in and a license is given, and if they opt out, the stores that have already been granted a license have those legacy rights to remain. So you can opt out again, but any historical license that has happened for that town to a retailer will remain. Next one. And Alice, interrupt me if you see similar questions in the chat to help me clarify. Age limits for purchase, 21. That's why Rachel was talking about like adult only products when she's talking about a town may create some ordinances or rulings around adult only products, but not specifically just cannabis. And is this similar to tobacco and alcohol? No, while they are working with regulation, compliance, and enforcement, tobacco and alcohol will stay with liquor and lottery, and the state Cannabis Control Board will be the enforcement agency for cannabis. I think they will use some similar pieces on that regulation, compliance, and enforcement, but they have yet to be finalized what that looks like. They have asked the legislature for the staffing and we'll get those details, hopefully before legislative session ends. It's one of the reasons to consider, we don't really know all the details yet, so that is an unknown. Are there long-term effects on use known at this time? And so during the teen years, we all, anybody in prevention will talk about how vulnerable the teen brain is, vulnerable for both damage and long-term risk of addiction. And any alcohol, drug use, cannabis affects how those connections get made. And studies do show that the use of cannabis is linked with reduced cognitive function in teens. Cannabis is illegal at the federal level, and government health research is only authorized to study products between 8 and 10% THC potency until they change the classification of cannabis at the federal level. Therefore, understanding of these long-term effects is really unknown at this time. Our own Vermont Medical Society has put out some information. There's a YouTube link there. I'll make sure to get it into the chat as soon as I stop having to talk so much. And then there's some information from our own Vermont Health Department at letstalkcannabisvt.org.
Marianne, can I just jump in? I think I saw
Sure.
a question in the chat about the unintended consequences that I referenced earlier.
Yes.
Mostly from a public health perspective, what other states are mostly reporting with high frequency are increased emergency room visits with psychosis or people generally freaking out because they've had too much THC. Cyclical vomiting is very much a product of high potency and frequent use. Also, there are increase in these high potency products are causing cardiac issues. There's higher risk of cardiac dysrhythmia and things like that. Driving obviously is a concern. When states legalized early in 2012, 2013, they saw a very sharp increase in accidents, both fatal and non-fatal. I think those have leveled out over time because states have done super big counter messaging campaigns and public safety got involved with messaging and really cracking down on that. And those stabilized, but we do see an increase in traffic accidents, fatally and non-fatally. And again, I already mentioned the calls to poison control from young persons. So those are the top key unintended consequences.
Yeah, then those are some good health ones. The other one that I thought of was the nuisance laws that Rachel brought up. There could be some different smells associated with the production of cannabis, not necessarily the retail sale. And in the case of Springfield, there was some production of some CBD product that was happening near the recovery center that wasn't going great for them, and they wound up working it out over time. But it's one of those things to kind of be aware of. You don't necessarily want that smell happening when people are trying to go to their meetings. All right. Yes.
Marianne, there's a question about clarification. When you say 60% for edibles, is that per piece or per package? For example, gummy bears are each piece is per milligram. So how much? Yeah.
That's a great question for the CCB. They haven't, I don't think they've worked out those packaging and labeling discussions too. I think one of the hard things about the edibles is, you're supposed to only eat perhaps a piece of a gummy bear, and people, that's not always clear. And that's one of the hard things about, regulating these products, is it's really hard to be precise with the dosing and things. So all I know is what the law says, which says a 60% THC cap for edibles. And then I think when they do the packaging, they're going to do that calculation of what that equals per milligram. So yeah, I can't answer that question. That's a little too specific for my wheelhouse, but you could pose to the CCB has public input where you can float questions to them. And maybe we could put the CCB link in the chat as well.
Great,
All right.
thank you. Next
Trying
question.
to get you to the next one, but it's stuck. There we go.
The zoning requirements for a cannabis dispensary. There's a buffer zone of that 500 feet from any school property, which is directly related to the federal drug-free school zone guidance. And then for towns, there's no zoning requirements, and you can add them, like I said, through an adult-only ordinance. And if one does not exist, then that can get created. So there's a Wethersfield example cited here. Rachel, I don't know if you want any clarification on that. So it can be an adult use bylaw instead of an ordinance, because there's different ways that the ordinances and the bylaws come to fruition. Towns can
Marianne,
consider, yeah.
Oh, sorry, never mind, keep going.
Yeah, towns can consider adding buffer zones around other places, playgrounds, libraries, youth centers, recovery centers, as long as they're not essentially banning cannabis retail. So this is very clear in the law. You can't make your regulations so strong that it essentially bans cannabis retail from the town once it's been opted in. Melanie, did you have a clarification?
Yeah, I was just going to clarify that prevention in the state of Vermont, we worked with the CCB on this buffer zone rule and really tried hard to advocate that it wasn't just schools, that we thought of playgrounds and other, family oriented places in towns. And they weren't able to include that for whatever reason. So we do feel strongly that if towns have that sort of family friendly feel to them, that they will consider these buffer zones. Because it's not something the state was able to do statewide.
Can I ask a question on this one area that you're talking about right now?
Sure.
Where it says that towns can create other buffer zones, where did they get to the authority to do that? How is that in statute? Because I was under the impression that we weren't allowed to do anything like that, that it was only that 500-foot buffer zone from school properties and stuff. But this one sounds like we have a lot more authority and power to do more different types of buffer zones. But where does that come from, that authority?
That's a Rachel question.
It would have to be, as she gets unmuted, as it just took me by surprise, it would have to be specific to the adult only use businesses, not specific to cannabis only.
Okay. All right. All right.
Rachel, is there further clarification?
Yeah, that's what I would say, is that you can't say cannabis establishments cannot be within, 1,000 feet of a school property or childcare center. But if you do have like a adult only, like a gun shop or an alcohol liquor store and a cannabis shop, and those are all under the category of adult use under zoning regulation, then that would count, that would be something that's not discriminating against specifically cannabis establishments.
Oh, okay, thank you. So it's just, so long as it falls under an adult use topic, it's okay, because you're not specifying just cannabis.
Yeah.
All right, thank you.
And we can make sure you get a copy of the Weathersfield ordinance because they have the language spelled out, and I believe they even have the state citation. So we're happy to share that with you.
That would be great. Thank you.
Mhm.
So the next submitted question, how can you decide if this is a good fit for our town? I love this question. When I talk about cannabis with towns, I talk about it. Does this work for your town right now? And look for guidance in that. Is this town to have a culture or a feel that would a retail cannabis establishment be a good fit for? Is there language in your town plan that indicates that that this is good for economic development versus not so great for the health of your town? So look for those clues within your town to see if this is a good fit. Think about, what is your town known for? How do you, when you think of your town, what are some words? And if those are the words that would describe having that retail cannabis there. Next one. And then this is does it have to be our town? So here's a little map that shows you, the green pegs are showing you where it has been opted in already. The red is where they have opted out. They have voted it down. Yellow, there's pending ballot measures in the yellow, and orange, towns with a March vote pending. So there's a lot of March votes popping up around. So we don't know what those answers will be. There'll be a lot of gap towns. There's a lot of towns in between these towns that are on this map too. So whereas it doesn't have to be in your town, it will be in Vermont. So like we started out saying, there's health issues whether or not a town opts in or not, and that's what we're primarily concerned about. So those are the submitted questions. I think that there was one late submission that I'm going to read from my notes. Should cannabis retail pass in Chester? What steps are required to prevent youth participation? And would this require an increase in police presence? So as we've already mentioned about the buffer zones and the density caps and the use of the Cannabis Control Commission to help regulate what that looks like in a town as some safety pieces, there's also some education around safe storage in a private home, safe use in a private home with secondhand smoke. There'll be some conversations around how this gets regulated, how this gets enforced in a town, and whether or not that requires increased police presence is going to be up to you. So we talked about some of those unintended harms, and so a town will have to be working with them as they come up. All right, Alice, what else do we see in the chat?
Okay, there's two more here. One is further clarification about applicants. What if applicants for integrated establishments are large out-of-state companies? What would be the impact on Vermonters? And can a town vote out to opt in on retail shops, but not okay for these large integrated licenses?
So a town gets to, the integrated licenses are a little bit different. And Rachel, if you have different information, or Melanie, if that I'm saying, please step in. The integrated licenses are a little bit different because they're going to established medical dispensaries already, which are kind of bigger places already. So, and the town doesn't get to decide on the integrated licenses with as much clarity as with a private license. So the CCB will be helping to decide on some of those integrated licenses, because they believe that there's only 5 of them that are set to be given out, but it's a limited amount. On the other hand, a town does get to decide who they issue a license to and what parameters that they would like to establish. And we know that some of our towns in this local community really do embrace the idea of keeping things local and making sure that things are staying here. So that is one of those ideals that hopefully a CCC would then make sure that they're adhering to as they make their decisions. Did I miss anything?
I think to over summarize, the integrated licenses will be issued in May, meaning already established medical dispensaries can start selling to anybody in May. And like Marianne said, they're already established, they're already here, and a town cannot, decide on those things. The other thing I think we didn't touch upon a whole lot is towns are only being given the option to opt in or opt out of retail cannabis. Towns are not able to decide whether or not they want to host a manufacturer or a processing plant or a grow. Towns don't have a say in that. So you can still, outside of the retail cannabis conversation, you might still want to be having some zoning conversations around, what conditional use areas of town these other businesses should go in. But residents cannot opt in or opt out of any other type of cannabis business besides the retail piece.
So is there a limit on the number of retail licenses in a municipality?
That is
No,
for, yeah. That's for a
that's what
town
we're
to decide.
recommending.
Yeah.
Yeah.
So
Yeah.
it could be as many as they would like. Most of the smaller towns would probably not overpopulate, but unless there's some parameters that's defined by the Cannabis Control Commission or within their existing over 21 policy, retail policy, it could be as many as they wanted unless it's contained in those two bodies, either already established because it's an over 21 regulation or within the CCC jurisdiction. More?
Okay. Then there's a question about liability. Example, bartenders can be held liable for serving a patron who is visibly drunk and then causes injury or fatality. How has this liability been discussed relating selling retail pot?
Some of the protections that the CCB, the state group, has tried to put into place on that is that there is no use on property of a retail seller. So there are no places to go and use like at a bar, where you would go and drink alcohol. There's no bar-like area to be using cannabis. So that takes that conversation, sort of distances that conversation a little bit. So no, I don't know if they're talking about that further. It remains in a discussion area that there might be that in the future, but it is not a priority for the CCB right now to be talking about use sites.
They also haven't outlined their rule that right now they're in rulemaking and they haven't got into compliance and enforcement. So they
Right.
might set a rule of what the they're called bud tenders, what bud tenders are or are not allowed to do and how they can be trained, but they haven't worked out those details yet. They're going to take some time on those.
Okay, a question about finances. How are finances handled of the retailer? Are banks able to open depository accounts for retailers?
I know very little about this, so I'll need help, but Vermont has allowed access to banks, unlike when California started their retail production. They did not allow access to banks, so there was a lot of cash around and a little bit of fear around what that meant.
I'm also out of my wheelhouse on this one. I think that there might only be certain banks that have agreed to take funds. I think any that are FDIC insured can't, because I think it's the credit unions and things like that that have agreed to establish for business. But I could just be like, I could have read an article that wasn't evidence-based or whatever and made that up. But I think that there are still some tricky, and our wheelhouse again really is in substance misuse prevention and public health. So.
And one more question here. When does the state session end for the final vote on the rules?
They were supposed to hand down their rules on March 1st, but I believe that they're delayed. So sometime after March 1st, they do have some urgency for creating these. There's regular meetings, and they seek public comment weekly on these pieces. So please feel free to engage in that public comment. We've consulted with members of the CCB frequently, and they are accessible and will respond.
Marianne, I feel like this question is asking about the legislative session. So
Oh, right,
the
thank you.
CCB is submitting their March rules. The
Right.
legislative session can take up till late May to close.
Thank
So,
you, Representative. Thank you for
Yeah.
clarifying that. And there are, like Melanie has cited, a couple of things that are in the legislature right now. I didn't get the name of the one that you were looking at before. We won't know about that until the end of the legislative session either. And that was on the THC levels for different types, forms of cannabis products
And the tax.
and the tax rate.
Yeah.
Did we get them all?
That looks like we've got all the questions.
Any last minute questions or thoughts? Because we did it with 3 minutes to spare. That's like amazing. I appreciate everybody coming out tonight on this crazy Monday night. When
One
we
more
realized,
slide.
oh yeah,
I wanted to share the slide with the contact information, and
That
we
would
are
be
going to
great.
post this recording. And so I
Yep.
want you all to see where that's going to go.
yeah. And so I was, thank you for that, because I was going to be saying that we tried to get this in before town meetings, just to start to get some conversation going around what a vote might look like on March 1st or February 28th, whenever your town does their vote. We are open for answering other questions or commentary afterwards. And here is our contact, as well as the website for the Green Peak Alliance blog. We will send out the recording of this if you have anyone that you'd like to pass it on to, as well as the slides. Feel free to pass it on. And if you're on social media, we'll be sharing it out on that after we get our recording finalized.
Yeah, and if you registered, we'll be emailing the slide deck out to all of you
Right.
by PDF.
Right. And if you didn't register, please reach out to us and we'll get it out to you. I appreciate everybody's time and have a lovely evening.
Thanks.
Thank you.
Thank you. Good job.
Thanks.
Good job.